lower body foam rolling sequence. With this sequence, what you can do, foam rolling, what it'll help to do is push blood through your tissues and also to just alleviate a little bit of that surface level tension. So it's not going to get really, really deep into your connective tissue, but it can help as an injury prevention mechanism or a great warm-up tool. One thing I get asked all the time is, oh my God, my muscles are so sore, should I roll them? Absolutely do not roll them. What happens with soreness is you just gotta wait it out, you just gotta rest. There's no magic trick to it. If your muscles are sore, which they're probably feeling pretty sore after your first few workouts with me, no problem, just let it rest. That's why we have these Wednesday sort of recovery days, and they'll be ready to go come Thursday, Friday, or the weekend. So again, with your foam rolling before a workout or on off days is ideal. What I'm gonna do is I'm gonna show you guys calves, hamstrings, quads, hip flexors, adductors, as well as glutes. So we're going to go through a whole lower body sequence. With your foam roller, there's different types of foam rollers. We have our ridged edge one here. This is your more standard foam roller where it's nice and flat and soft. And of course, you can use a wine bottle if you don't have a foam roller. So you're probably seeing a little theme here. So I'm going to use the ridged one because I've done a lot of foam rolling and my muscles can tolerate it, but if they can't tolerate it, you want to move to something more like your standard foam roller where it's a little more tolerable but still hurts a little bit. You know you're making progress with foam rolling if as you do it and as you continue to do it, it hurts less and less. With my ankles, we always have one anchor leg and then the one that we were rolling on. Typically, for any foam rolling sequence, I'll go for 30 seconds to a minute, depending on the muscle, depending on how much it hurts, depending on how much I know I need it. And also, too, you're going to see, look at my big toe. I'm pointing in all different directions to target different areas of that muscle. So for me, out to the side is typically where I feel it the most in my calves, or right on the inside there. Again, 30 seconds to a minute one side, 30 seconds to a minute on the other side, and then I'm going to go to my hamstrings rolling up and down. This is definitely more of a tension area, so I'll usually spend close to a minute on my hamstrings. Same thing, more on the inside is where I tend to feel it. If I really want to get deeper into a spot, I'll put some pressure into that area so I can really feel it. 30 seconds one side to a minute, 30 seconds to a minute on the other side. Quads are probably the most common area that really, really needs it. Quads meaning rectus femoris, as well as our deep hip flexors. So I'm going to roll up and down like so and spend a lot of time right at that anterior portion of my hip. Just rolling. I'll even sit there and take a few deep breaths if I find a spot that I think I need to really focus on. So just a big deep breath in and out. For anyone who deals with anterior knee pain, this is definitely something I often prescribe to clients. If you're a runner, definitely a big one. If you sit a lot throughout the day, definitely a big one. You want to be doing this a couple times a week and go through a couple rounds of that 1 minute per side, 1 minute on the other. When I'm explaining this, I tell clients to get into a plank and then I bring one knee up. So this is my sort of anchor leg, and then I'm going to roll up and down on that one side. For my adductors, it's the same thing, except I'm going to switch, and now that leg that I brought up, I'm going to rest on my other side, and I roll up and down. So you always want to roll up and down the lines of the muscle, coming in and out, deep into that groin. Again, problem spot for me. I'm going to try and reach right in there as much as I can, and then I'm going to switch to the other side. And then the last one's going to be our glutes. For my glutes, sitting on the roller. This might be a little tougher with the wine bottle. I probably wouldn't recommend it. It's not going to be thick enough. So if you have a ball, balls are often much more common for doing your glutes, and you just sit on the ball right on your glute muscle and then roll it up and down. Remember, our glute fibers are reaching this way, so from here I'm going to roll up and down. I'm going to cross that leg just to expose my glute a little bit and go back and forth. In terms of balls, lacrosse balls work the best. Soft balls are really good, but also too can be really mean. And tennis balls are a little bit softer. Sometimes they bend, sometimes they break, so those don't work as well, but you can start with a tennis ball, work your way up to either a lacrosse or a softball. 30 seconds to a minute on that one side, 30 seconds to a minute on that other side. Again, I'll put these 5 into your checklist, but just to recap, you have your calves, Then you have your hamstrings, you got your quads, you got your adductors, groins on the inside, and then you got your glutes on the outside. In terms of IT band, I don't tend to roll IT band. It's a super thick, super fibrous band. You can roll it, it's kind of hard to get to, but from everything that I've heard, it's not really gonna do too much because there's just so much fascia in there that foam rolling is not really going to do the trick. So that's your foam rolling sequence. Should take you about 5 minutes. You can spend 10 minutes on off days. And again, if you sit a lot, if you're a runner, or if you just tend to have tight muscles to begin with, foam rolling is definitely going to be your friend.